करना होता है, एंडो में और कुछ नहीं करना होता. Right? So this is what I'm trying to tell you today. You have to think beyond. Just a second, getting a call from Ramesh ji. Okay, sorry for that disturbance. So that is what I'm trying to tell you today. Restoration of endodontically treated tooth or teeth. Right? It is not just कि हर root canal treated tooth पे crown fix हो ही जाना है, crown लग ही जाना है. ऐसा कभी नहीं होता. ऐसा हमेशा नहीं होता. So this is just for you to tell you that we have another procedures more than root canal. There is more to endodontics than just root canal. Right? So in today's class, before I go with the outline, so what I'll be discussing today will be introduction, restorative decision making chart. What is of a rule? Now these are the things that you're supposed to jot down. What is of a rule? What is a core? Evaluation of teeth in cases of anterior and posterior. What do we do? What is a post? Principles of post selection and take home message. So now you read something known as post. अब ये post क्या है? That's what I'm saying कि post and core एक type का treatment modality है that we do in endo, post and core. Now I'm just gonna give you a brief introduction to this topic with this video and then we quickly move ahead. I'm just confirming whether the video is audible or not. Sometimes when I think it is not because when I'm connected to my Bluetooth.
We use a post and core to replace the missing portion of a severely broken down tooth after root canal therapy and prior to placing a crown. The post, often made of metal or fiber reinforced resin, is used to anchor a core, which is also called a buildup. First, we prepare a space for the post in one of the root canals. We try in the post and then cement or bond it in place. Next, we place the new core material on the tooth. Lastly, we shape the material to accept the crown. Placing a post and core in a tooth prior to a crown strengthens the tooth and provides better retention for the crown. A post and core is an important step for saving teeth that may have been damaged by fracture. So, here I'm trying to tell you one thing, that if you ever see a question on restoration of endodontically treated teeth,
Just know कि लिखना क्या है. You have to write about, describe about post and core. I hope I'm clear on that. Let's move on. Introduction. A successful endodontic treatment has to be complemented with an adequate post-endodontic restoration to make pulpless tooth function indefinitely as an integral part of the oral masticatory apparatus. So your job is not just done if you're done with endo. You have to think beyond that. You have to basically make a treatment plan for the patient and think for yourself and for the patient that endo ho gaya, what am I going to do next to the patient? Even if I'm referring to this patient to a prosthodontist or any other friend of mine, I should be knowing and I should be aware well in advance कि ये successful होने भी वाला है या नहीं, right? So definitive restorative treatment should not be initiated if the treated tooth exhibits any of these. Very, very well self-explanatory. If it has a poor root canal filling, obviously you will not go for a crown. If it has an active inflammation, but of course not going for a crown because crown means added expenditure from the patient, giving him or her false hopes. No, you do not want to do that. Pressure sensitivity, if the patient is still sensitive, it has exudate coming out of it, it has a fistula, periodontal disease is quite active and it is severe loss of sound tooth structure. In cases like these, where there you have questionable prognosis for the tooth, offending tooth, you will not go ahead and plan another treatment on top of your root canal. Am I clear? As you can see the picture, the second picture shows a broken core and a post. Under जो stick like here, that's what the video was trying to tell you. That the stick or the long rod that you see is known as the post, and on top of it, you have a core, and उसके भी ऊपर क्या आ रहा है? उसपे crown आ रहा है. So in no way I'm trying to tell you that core and crown are synonymous. They are not synonymous. They're not same. First we have a post, then we have a core, and then we have a crown. So this is a very beautiful decision making chart given in Grossman. I want you guys to go through Grossman if in case you get your hands on. Let me just put it aside. It is disturbing me. Okay. Quickly going to endodontically treated tooth. We have already done the treatment. What do? We have to assess for poor root canal filling, active inflammation, pressure sensitivity, exudate, periodontal disease, severe damage, as I just mentioned. If any of this is present, then you got to stop. You have to retreat, you have to monitor, or maybe last, if nothing is to be done, then you have to extract it. In case if you're done with your beautiful root canal therapy and it is an anterior tooth, then you have to see what you can do if there is minimal coronal damage. If there is minimal coronal damage, intact marginal ridge, intact cingulum, intact incisal ridges, aesthetically acceptable, there is no color change, no bleaching required, then what you can go for? You can go for a complete coverage. You may not go for a complete coverage. Your composite restoration or your core buildup is sufficient enough to provide good life to that tooth. So I'm trying to say, if, who's that? Any questions, please? Okay. So what I'm trying to tell you here is, okay. So yeah, in such cases, crowning is not required. Conservative treatment with bounded raising composite is sufficient. In another anterior tooth, if there is moderate coronal damage, one or two proximal lesions are there, average size tooth is there, you need to go for a full crown. Then in the third category, if there is significant coronal damage, undermined marginal ridges, loss of incisal edge, there is coronal fracture or aesthetically unacceptable, in such cases, you have to go for a treatment. I repeat, there is undermined marginal ridges, loss of incisal edges. So in this case, most of the walls of the tooth are gone. In such case, you will go for a custom made or a prefabricated post and core. Now, what these terminologies are, we're going to quickly, go through in my subsequent slides. In case of custom made or prefabricated post, in case of small circular canal, choti si canal hai, you can go for posts which are already in the market prefabricated. Sizes are available. You can try in and see if it fits in your small canal. If it is extremely flared canal, in such cases you have to basically make your own post. You have to take its dimension. You will use your wax to make sure you get the exact flare of the canal. You will make it yourself, and that is known as a custom made post. Next we have is, so we're done with anteriors. For posteriors, cuspal coverage is required. Why so? Because most of your masticatory load goes to your posterior teeth. In such cases, there's no shortcut. Full coverage crown is required. Minimal coronal damage हुआ है, low risk of fracture, minimal occlusal forces, intact buccal and lingual cusp. We can go for conservative treatment minimum. MOD inlay, MOD onlay और नो पोस्ट एट ऑल. अब इसमें हम क्राउन की बात नहीं कर रहे हैं, क्राउन तो देना ही है, ठीक है, उसका कवर तो करना है. नाउ वी आर जस्ट टॉकिंग अबाउट पोस्ट देना है या कुछ और देना है, राइट. ऑनले आप लोगों ने अभी पढ़ा नहीं है, यू विल बी टॉट मे बी दिस ईयर, राइट. ऑनले इज ऑल्सो काइंड ऑफ अ फुल कस्पल कवरेज, ठीक है. So that way we have to judge ki moderate coronal damage hai, minimal hai, या there is a significant coronal damage. If there is moderate coronal damage, minimum of one sound cusp or extreme root curvature, we have to go for amalgam, coronaradicular core of or resin composite core followed by full coverage crown. मतलब इस case में we have to provide a core and then a crown. Extremely, then we go for significant coronal damage, little or remaining, no remaining coronal tooth structure is there. There is high risk of fracture, FPD or RPD का abutment use हो सकता है ये tooth. In such cases, we have two options. एक तो है कि अगर canal is extremely taper, मतलब we will go for a custom made post, ठीक है, followed by a full coverage crown. अगर कनाल का सर्कुलर क्रॉस सेक्शन है, टेपर का क्या मतलब है कि काफी फ्लेयर्ड कनाल है, इस कनाल को खुद से बनाना पड़ेगा. यू विल हैव टू make a custom made post out of it. Now you might not be able to relate completely to whatever terms I'm using right now, but I'm sure by the end of this class you will be able to relate very well. So in cases of circular canals, we have prefabricated, already available commercial posts coming in various sizes. You just have to match the size of your canal and then use this post, make a core on top of it, and then do a crown. I hope I'm making little bit sense as of now. Let's move on. So this I got from one of my conferences back in the day. So when do we actually need a root canal post? This is a very very informative image. If you want, you can take a photo or draw it. जिसमें tick हुआ हुआ है, those are the conditions where you actually where your tooth requires a post, requires an additional support for the core. To consider, what we have to consider is the number of remaining cavity walls. As you can see, the first image is a class 1 cavity. The second image is a class 2 cavity. The third image is a clear cut MOD cavity, right? MOD याद है हम लोग को amalgam में भी देते हैं हम लोग देंगे भी. In such cases, your post selection will start from an MOD cavity. Two walls of your cavity of your tooth are missing. That means it requires additional support for the core. In no way I'm trying to say कि ये जो post है, ये जो rod-like structure है, it will strengthen the tooth. You're highly mistaken if you think that the post will strengthen the tooth. The post in no way strengthens the tooth. In fact, if done wrongly, might even help in fracturing the tooth, right? Right? Might promote the fracture. So post का function क्या है? Post का function is only to support or to strengthen the core, right? The core, the filling that you do before the crown. उस चीज को सपोर्ट करने के लिए एक असेंबली फॉर्म हो जाता है पोस्ट कोर एंड क्राउन का. It's a single assembly, also known as a monoblock. So third, in the fourth category, you see three walls are missing. And in the last case, all the four walls are missing. Now, this is a kind of a hopeless case, but in this also we have, factors which will determine कि हमारा case successful होगा या नहीं. What are these factors? We're going to discuss now. Consideration in restoring endodontically treated teeth. What do we have to consider? And see, there is difference between an endo treated tooth and a vital tooth. Now, don't tell me you don't know what is the meaning of a vital tooth. Vital tooth is the one in which the pulp is functioning. There is blood supply, there is nerve supply, the entire tubules are vital. Everything is vital, right? So this is a sound tooth. Now we're discussing about endodontically treated tooth. So one thing that should come into your mind is ये तो नॉन वाइटल हो चुका है, right? So what are the differences? Endodontically treated teeth are associated with unique structural and functional challenges. Second one we have is moisture loss. Third, we have is architectural changes, then biomechanical behavior, biological weight, and protecting the remaining coronal tooth tissue by creating a ferrule. Now, quickly, I'm going to discuss this. ये unique structural and functional challenges क्या हो सकते हैं? Moisture loss की हम बात करें, so there was an assumption that pulpless teeth मतलब the ones that we just treated with endodontically treated teeth are pulpless teeth may have increased brittleness from moisture loss. ज़्यादा brittle हो जाते हैं ये teeth, right? But इसके ऊपर काफी sparse evidence है to support this concept. But most of the dentists like to believe that this tooth is brittle and it has become quite weak as compared to a wider tooth. Next we have is architectural changes. In cases of MOD cavity preparation, just imagine mesio-occlusal distal cavity. मतलब दो walls clearly involved हैं उस cavity. There is जो tooth की जो stiffness है ना, that is reduced by 60%. 60% is a major loss for the tooth, right? Only 40% of strength of the tooth is remaining. Just imagine 60% loss हो चुका है. So just imagine if the tooth has undergone caries, trauma, previous restoration, access cavity preparation. So tooth का strength कितना degree तक lose हो जाता है, right? That is why there's a difference when you are trying to treat an endodontically treated tooth. Next we have is biomechanical behavior. The intact vital tooth, it has a hollow laminated structure that deforms under load but completely elastic when we are in physiologic loading. So you know that vital tooth जो होता है वो उसमें elasticity इतनी होती है कि load के अंदर से बाहर निकलते ही it becomes elastic again. That means it has a proprioceptive feedback mechanism. What we're talking about a vital tooth here. But in cases of a non-vital endodontically treated teeth, we do not have a proprioceptive feedback mechanism. It's lost. Next, we have is biological weight. Even the perio people will teach you a lot about biological weight. I myself have a class on biological weight, I think for you guys only, which I will be taking very shortly in a few weeks or so. So biological weight is the space is required between the margin of a restoration and crest of the bone to have a healthy gingival attachment. Right? जब हम crowning करते हैं, जब crown देते हैं, cap देते हैं, so we have to respect the healthy gingival attachment. ऐसे ही नहीं कि उसके ऊपर डाल दिया बस कैसे भी crown. अगर तुमने कैसे भी क्राउन डाल दिया तो जो उसके नीचे बोन है अगर वो हेल्दी नहीं है then you will have a tremendous bone loss. Your crown will fail. So there is an absolute minimum width of 2.5 mm between the restoration key margin and the crest of the bone that you have to respect. If you don't, then your treatment will fail. Now, most important thing about today's lecture is protecting the remaining coronal tissue. Now, this is a thing that you have to write down right away. Creating ferrule. Now, what is creating ferrule? I hope I'm clear enough and sounding fine. It's just a little elaborative class, so I'm just focusing on the most important things for today. I hope you're writing. So, okay. So, we're talking about protecting the remaining coronal tooth tissue by creating the ferrule. Start writing right away. Ferrule is defined as a band of extra coronal material at the cervical margin of a crown preparation that encompasses the tooth and provides resistance form to the tooth. I repeat, it is a band of extra coronal material at the cervical margin of a crown preparation that encompasses the tooth and provides resistance form to the tooth. अब लिखने के लिए ये definition you have written. Now इसका literal meaning क्या है? I'm going to tell you very shortly. The word ferrule is derived from the Latin word ferrum, meaning iron, and virola, meaning bracelet. Right? It is acting as a bracelet. Thus, when we talk about a term called a ferrule effect, this effect occurs because of crown bracing against the remaining supragingival tooth tissue. कहने का क्या मतलब है? इसका मतलब ये है, ओके बिफोर वी मूव ऑन, इसका मतलब ये है जब टूथ की सारी वॉल्स थोड़ी बची हैं, कम बची हैं, कितनी बची हैं, व्हाट यू हैव टू लुक इनटू इट इज यू हैव टू मेक श्योर दैट यू आर लुकिंग एट that you are looking at the remaining tooth structure, kitna tooth structure bacha hai uska, that will act as a bracelet. Okay, that will actually give more strength to the crown that you're going to be covering it with, right? Restorative treatment planning of non-vital teeth. So we have to depend on amount of remaining tooth structure, functional demands that will be placed on the tooth, need for the tooth as an abutment in larger restoration. As I've pictured, placed pictures of non-vital teeth on this, you can see these are discolored, absolutely non-vital teeth. Now we are talking about treatment of endodontically treated teeth or restoration of endodontically treated teeth. It goes without saying that you have to include something known as post and core. अब post का तो मतलब तुम्हें थोड़ा बहुत समझ आ गया that it means a rod that goes inside the root canal, right? What is a core? Now, as you can see on the image, the right image, you can see I have labeled this the crown and the core. So here I am demarcating that in no way crown and core are synonymous. They are not the same things, right? And एक चीज मैंने लेबल की है फेरूल. फेरूल का क्या दिख रहा है तुम्हें? फेरूल का क्या मतलब दिख रहा है? फेरूल इज द थिंग, इज द टूथ इटसेल्फ. जो स्ट्रक्चर तुम्हें दिख रहा है फेरूल की लेबलिंग में, that is the tooth itself. Now you have to know or you have to remember कि फेरूल होना जरूरी है for a crown to be placed on it. अगर फेरूल नहीं है, अगर बिल्कुल बेस उसका खत्म है टूथ का, so forget about this tooth being restored properly. Forget about it. You need that bracelet of the tooth on top of which you can provide the core and उसके ऊपर तुम्हारा एक crown आ सकता है. So let's just talk about core. Core consists of restorative management of coronal portion of a tooth after the completion of endodontic treatment. I repeat, core consists of restorative management. मतलब you're using some restorative material on this. Core in no way is the tooth. Tooth is the ferrule, and on top of it we have the core. This material replaces carious, fractured, or otherwise missing coronal structure and retains the final crown. I'm repeating and I'm requesting if in case you have any doubts during the any of my slides, just write it down so that we can discuss by the end of this class. Okay. Quite an elaborative class, but let me just finish before we can take your questions. So next we have is if sufficient coronal tooth structure remains to provide retention to the core, then the post may not be required. So इधर मैं एक चीज बोल रही हूँ which is important that every endodontically treated tooth requires core. हर एंडो ट्रीटेड टूथ के ऊपर कोर का रेस्टोरेशन करना इम्पोर्टेंट है, पर हर एंडोडोंटिकली ट्रीटेड टूथ को पोस्ट देना जरूरी नहीं है, हर टूथ के अंदर पोस्ट डालना जरूरी नहीं है। तो यू शुड अंडरस्टैंड कि किसी ने रूट कनाल किया तो उसको ऐसे ही नहीं छोड़ देंगे, पेशेंट को ऐसे ही नहीं भेज देंगे। क्राउन करने से पहले वी हैव अ थिंग कॉल्ड एज पोस्ट एंडोडोंटिक ट्रीटमेंट और पोस्ट एंडोडोंटिक बिल्डअप। We call the patient again, obturation हो चुका है, we give a composite restoration or XYZ restoration, and on top of it only we will give the crown. So वो restoration जो है उसी को हम core कहते हैं. I repeat, if sufficient coronal tooth structure remains to provide retention to the core, then a post may not be required. This is a video. Let's watch on the core and post. Sorry, let me just disconnect with my Bluetooth.
A cast post and core is a one-piece unit that includes a post, which is placed into the inner part of the tooth, and a core, which provides a foundation for the crown. It is precision crafted in a dental laboratory, so the procedure may take 2 or more appointments. On your first visit, we numb the area to make you comfortable. We may also use a rubber dam to protect your mouth while we work. Then, we remove any decay and shape the tooth to accept the final crown. We remove some of the filling material that was placed during the root canal procedure and prepare a space in the inner part of the tooth. Next, we make a specialized impression that will provide the exact dimensions of both the inner and outer portions of the tooth. Using the impression, the lab makes the cast post and core to precisely fit your tooth and your crown. In the meantime, we usually place a temporary crown to protect your tooth. On your next visit, we remove the temporary, cement in the new cast post and core, and adjust it if necessary. Lastly, we place the crown. Placing a cast post and core in a tooth prior to a crown strengthens the tooth and provides stability for the crown. It's an important step for saving a tooth that had. So I hope you are able to understand kuch kuch thoda bahut. What are we talking about in this lecture today? Right? Kuch kuch thoda bahut. When we're talking about a metal cast post, as you saw in this video, we saw
पोस्ट और कैप की, राइट, सॉरी पोस्ट एंड कोर की एक पूरी असेंबली बन गई, राइट. सो दैट्स व्हाट इज इम्पोर्टेंट. ये just a second, I think it is disturbing the whole thing. Okay. Attachment between the tooth, post, and core is mechanical, either mechanical, chemical, or both, as core and post are usually fabricated of different materials. Now, what are these materials we have in the market? Like the preformed हो गए, preformed or prefabricated posts. I told you in the beginning, preformed or prefabricated posts are the posts which are already available. A lot of sizes are available in the market, and if you have a small round circular canal and you know इसमें ज़्यादा मेरे को adaptation की ज़रूरत नहीं पड़ेगी, I'll go to the market, get the post and try using different sizes and see what actually matches the size of my canal, right? And that is my post. उसके ऊपर मैं एक और build up करूँगी, and I'll take an impression and I'll send it to the lab and my crown is made in 2-3 whatever days, right? So that's the whole procedure. In aesthetic post, we have an ocean of posts available in aesthetic posts, basically based on GIC, zirconia, composite. There is no limit to aesthetic post systems today. This is the major advancements that has happened in post and core or endodontically treated teeth ka restoration. So if given a question on this might come as a long note also. So if given a question on this, you should know there's an ocean of availability in this post and core also. Aesthetic post में बहुत सारे options available हैं आज, like GIC, zirconia, composite, lot many. ठीक है. Cast post is the one that we saw the video of अभी recently जो हमने अभी video देखा. That was cast post. क्या था वो? We're using a wax and we're taking the entire shape of the root canal. ठीक है. इसमें क्या कर रहे हैं हम? We're taking the size of the post, like size of the canal, and then उसके ऊपर ही we are building the core. कोर बिल्डअप भी हमने वैक्स से ही किया है. आई एम रिपीटिंग, कोर बिल्डअप भी हमने वैक्स से ही किया है. जब लैब से आपकी ये होएगी कास्टिंग, जब वापस आएगी, व्हेन द कास्टिंग इज बैक, You will see that is an entire assembly. The post and the core is a one single monoblock assembly that you will try into the root canal. You will cement it, maybe adjust the measurement using your erota, thoda idhar udhar, and then you will take the impression, send the impression to the lab, and your crown is made. I hope I'm making thoda bahut easy for you, right? Let's move on. Desirable physical characteristics of a core. Now, this is a beautiful image I'm showing you on the right. You can see root canal treatment ho gaya hai. There is 5 millimeters of GP on the apically, which we have left, right? Because we don't want to hinder the apical seal of the tooth. इसके अंदर बहुत सारी accessory lateral canals are present. We don't want to hinder the apical seal of the tooth because इससे नीचे हम जाएंगे so we might open the accessory canal. So we don't want to. We want to leave at least minimum of 4 mm of apical GP right there. उसके ऊपर we have a core. उसके ऊपर we have a post. As you can see in the image, we have placed the aesthetic post that I discussed right now. Aesthetic मतलब वो metal नहीं होगा. It will be non-metal. So we placed the aesthetic post. On top of it, we have done a core buildup, and uske upar we will be giving a crown. So desirable physical characteristics of a core are it should have high compressive strength, dimensional stability, ease of manipulation, short setting time, and ability to bond to the tooth. Very easy. कॉमन कोर मटेरियल्स दैट वी यूज कोर मटेरियल क्या है जिससे हम रेस्टोरेशन बिल्डअप करने वाले हैं जिसके बाद वी विल बी टेकिंग द impression. So what are these common materials that we use daily on a daily basis? Mostly we use composite, resin-based composite. Silver amalgam was used back in the day. Cast gold not used now so much. Glass ionomer type 2, right? Evaluation of teeth. Now, ऐसा नहीं है one thing fits everything. Like one post will fit all anteriors and posteriors. ऐसा नहीं है. We have to evaluate the teeth. Like with maxillary central incisors and canines, the decision to place a post should be based on the amount of remaining coronal tooth structure. The same thing that I discussed in the second, third slide of mine. The chart, this decision-making chart that I got from Grossman, the same thing I'm discussing right now that you have to the entire treatment depends on the amount of remaining coronal tooth structure depends on the amount of or the number of walls you are left with occlusion and function of the tooth that becomes your posterior teeth ka demand. Let's just quickly read the heading. A full coverage crown is not mandatory for every endodontically treated anterior tooth. हर anterior tooth पे पूरा crown देना, full coverage crown देना mandatory नहीं होता है. But फिर भी सब देते हैं. Most of the times you see the practitioners giving crowns on anterior teeth also, which is required. Why so? Because उनमें one or the other thing is present. What are these one or the other things? Clinical decision is based on the extent of loss of tooth structure and aesthetics. I repeat, loss of tooth structure and aesthetics. कई बार patient की खुद की demand होती है that my tooth is discolored and that is why they reach the dentist, right? Approach the dentist. In such cases, you have to make sure that aesthetics are, you have sorted the aesthetics. If first condition is only access cavity preparation is done with no discoloration. The tooth is absolutely sound. उसमें discoloration नहीं है. Sound as in discoloration बिल्कुल नहीं है. It's a vital tooth. तुमने थोड़ा बहुत caries हटाया, root canal किया. अब क्या करोगे? You will do a good composite core build up, and that is it. The second criteria is loss of one or both proximal walls and or sufficient or significant discoloration. In such cases, एक तो दो proximal walls not there plus discoloration. Only composite core buildup will not help it. You have to provide strength to the tooth. You will give a full coverage crown so that it does not fracture under load. The last one is there is extensive loss of tooth structure. In this case, not only crown, but you need post and core also. I hope thoda bahut clear ho raha. There's an image I'm showing on the left. This image or this radiograph is trying to show you in cases like these, you might not even go for a crown. A good composite buildup will be sufficient. As you can see, there's no damage, no caries. एक अच्छा सा रूट कनाल किया है थोड़ा सा केरीज होगा थोड़ा सा एक्सपोजर होगा एंड you're good to go with a composite core buildup. Now let's discuss about, please try to see the images that I've got you. Just a second, need some water. Acha, one important thing, you can find my lectures on YouTube also now. I'm trying to basically upload these lectures on YouTube, so you're free to watch them anytime, right? I'm just gonna take some time there and try uploading most of it, but you can find this lecture there also. So for posterior tooth, decisions are clearer because डिसीजन क्लियर क्यों है इतना सब झंझट नहीं है मतलब उस पे बहुत ज्यादा लोड आने वाला है पोस्टीरियर टूथ पे मतलब मेरे को मोस्ट ऑफ द टाइम्स 99% क्या 100% टाइम्स आई नीड अ क्राउन टू कवर इट protected from occlusal loading. Forces on posterior teeth are predominantly vertical. Endodontically treated posterior teeth should receive cusp coverage, but in most cases do not require a post, right? So post and core majorly हम देखेंगे we will be doing in most of the anterior teeth. Posteriors में इतना ज्यादा नहीं चाहिए होता है core एक crown अच्छा दे दें करना भी होता है. I'm not saying we don't do post and core and molars, we do it, right? But you have to 100% give a crown to the tooth, otherwise it will fracture. Vertical fractures are so deleterious that you have to, they will, lead you to extractions only. So you have to take care of those. And vertical fractures can be prevented by crowning the tooth. Right? Let's move on to the indications of post and posterior tooth. As the image shows, इधर मैं आपको एक image दिखा रही हूँ. On top, there is a post placement, as you can see. मैंने last का 5 mm GP, I've left it. Then I've placed the post in the second image. We have done a core buildup on the post, around that post, and made it into one assembly. ये हो गया आपका post plus core. Now what we will do next is we will give a crown to the tooth, right? Next, in the same image, you can see इधर पे क्या किया है post किया है. You can see the now you can read the radiographs well enough, right? I'm showing you a post placement. Then there is a crown, and then there is a core, and on top of it there is a crown. This is exactly how a crown looks radiographically. ये crown भी कर दिया उस tooth के ऊपर. So indications of post in posterior teeth is extensive loss of coronal tooth structure. The tooth has to serve as an abutment for RPD or FPD. These are the major indications for post in posterior teeth. Now, what is the primary function of post? Now, this is one question जो सब लोग confused रहते हैं. किसी से भी किसी भी resident से भी if you make this question, ask this question, or maybe a really big shot person in endodontics, you ask this question, what is the function of post? You know what they'll say? They'll say, "Acha, post ka function, it strengthens the tooth, or maybe it strengthens the root." That is so wrong. I don't know who there's this I don't know wrong book or something that they read, and then majority of people will be saying post ka function is to strengthen the tooth. No, just imagine you placing a metal rod inside the tooth, or you placing a rod made of fiber, GI, zirconia, whatever, inside the tooth, and you're thinking कि ये tooth को strengthen करेगा, ये तो और weak करेगा, right? Don't you think अगर मैं एक metal post गलत डाल दूं, it will actually eventually lead to fracture. It might even be the biggest reason for fracturing the tooth or tooth root, right? So never, 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 never say that a function of the post is to strengthen the tooth. No. What is the function of the post? Function of the post is just to strengthen the topmost core. If you only place core, do you think it will form one large assembly inside the tooth? It will not. So basically, the only function of post is to make sure it is strengthening the core. जो मैं उसके ऊपर फिलिंग करने वाली हूँ उस चीज को strengthen करने के लिए उसकी एक assembly बनाने के लिए tooth के अंदर, that is the sole purpose of the post. Right? I repeat, it provides retention. It provides retention to the core material. Please write this down. Post does not strengthen or increase fracture resistance. If you ever say this, if it ever comes out of your mouth कि post हमने इसलिए डाला ताकि tooth fracture नहीं हो, you're saying the opposite thing. Post in no way will prevent your fracture. In fact, it might be the biggest reason for fracture happening. तो हमने पोस्ट डाला क्यों? पोस्ट डाला टू सपोर्ट द कोर, राइट? जो टूथ एकदम सैल्वेजेबल नहीं लग रहे हैं, जिनकी वॉल्स ज्यादा मिसिंग है, इन टीथ लाइक दोज you can think of giving a post also. Core तो हम वैसे भी देते हैं, right? We give core to every endodontically treated tooth. So in teeth which have major walls missing, in such cases, we can take an additional support which might support our core, and it will be a one assembly monoblock, and on top of it, we can provide the crown. Right? Let's move on with the principles of post selection. Very, 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 very important. Please write this down. Question will definitely come on post and core, or They never ask you postal code directly. They want to know कि तुम्हें पता भी है कि postal code किस चीज में आता है. So the question will always be like restoration of endodontically treated teeth. So जो जिसने ये chapter पढ़ा नहीं होगा, people who are absent today, you know what they'll write? They'll only write अच्छा crown करना होगा. endo treated teeth के ऊपर क्या कर सकते हैं ज्यादा से ज्यादा? Crown ही तो कर सकते हैं, और क्या करेंगे? So I'm sure people, those who are absent today, not listening to me today, they will just write अच्छा full coverage crown. That is the solution. They will not even think कि ये question पूछा क्यों गया, right? So that is one question that you have to describe in detail about post and core. Right. So there are certain principles you have to stick to before you select a post that is going inside the root. So these principles are post length, tooth anatomy, post width, canal configuration, and post adaptability, post design, lutex cement. These are the various important factors that you have to, keep in mind before you select a post design and go for it. As you can see in the first image, there is a root canal treated tooth. Obturation is already done. What you do, you do a sectional obturation after it. You sectionally remove the gutta percha and leave about 4 to 5 mm of gutta percha in the apical region of the tooth, because you don't want to hinder the apical seal of the root canal treated tooth. Apical seal is most important. Then what you do, as you can see in the image, तुमने एक cast post plan किया. Cast post तुमने एक wax लिया. Wax से तुमने you recorded the entire anatomy inside the root canal. You gave it to the lab and they created a cast post for you. This is made of metal. Cast जब भी मैंने use किया, that is made of metal. Okay, some kind of metal. So this post or the metal post is fabricated inside the lab. It is here. Now you have to do a try in. As you can see, there is tad bit of space between the gutta percha and the cast post. This much space is okay. इससे ज़्यादा space होगा, that is not acceptable. Although space आना ही नहीं चाहिए. There should not be any dead space. But this was a good image, so I wanted to show you. Next, we go on to post length. Quickly, जो important है फटाफट लिखते जाओ. Length and shape of the remaining root determines the length of the post. I repeat, length and shape of the remaining root determines the length of the post. अब ये तो बड़ा वेग सा स्टेटमेंट है. अब मेरे को फिर भी समझ नहीं आया what should be the length of my post. So इसको और precisely explain करने के लिए I've got you this thing. In long rooted teeth, I repeat, in long rooted teeth, the post can be as long as possible without disturbing the apical gutta percha seal. राइट, उतनी गड्ढा पर्चा रखो 4 to 5 mm. उसके बाद जितनी लेंथ है उस पूरे में आप पोस्ट बना सकते हो. Even 3/4 the length of the root, right? 3/4 the length of the root. Yeah, this is applicable in cases of long rooted tooth or teeth. I am hoping that you guys are writing this down. This is very important for you. In average to short rooted teeth, छोटे दांत है, average height है, उसका क्या करेंगे? The post length is determined by retaining 5 mm of apical gutta percha in order to ensure apical biological seal. इसमें भी वही सेम चीज अप्लाई कर रहे हैं, बट तुम कितनी लेंथ रखोगे that depends कि whether or not you're respecting the apical gutta percha and keeping it to maximum 5 mm, minimum 4 mm. इतनी तो रखनी ही पड़ेगी. उसके बाद जो लेंथ है वो you can use as the post length. So it is last point is it is desirable to extend the length of the post to at least 4 mm apical to crest of the bone. Now this is a little tricky to understand. Just imagine root के side में, जो root आपके अंदर है उसके side में क्या होता है? उसकी side में bone होती है, right? Crest की bone होती है, alveolar crest होता है. What alveolar crest क्या होता है? It is made of bone. So what is it trying to say? कि इतना छोटा पोस्ट नहीं होना चाहिए दैट तुमने कैनाल ओरिफाइसिस के अंदर डाला और डालते ही खत्म हो गया. राइट, इट हैज टू गो इनसाइड द रूट टू द लेवल 4 mm अपाइकल टू द क्रेस्ट ऑफ द बोन. इतना छोटा नहीं होना चाहिए कि साइड में जो बोन है वो सिर्फ 1 mm ही कवर हुई है. आई होप इट इज ट्रिकी टू अंडरस्टैंड, बट आई होप आई एम एबल टू मेक यू अंडरस्टैंड व्हाट आई एम ट्राइंग टू से. is you can see the bone on the sides, right? पोस्ट की जो लेंथ है, ये जो लेंथ है, ये इतनी छोटी नहीं होनी चाहिए. इट शुड बी एटलीस्ट इट शुड गो इनसाइड इतना कि साइड की जो बोन दिख रही है, व्हाटएवर बोन दैट यू आर सीइंग ऑन द साइड, क्रेस्ट बोन, that is covering at least 4 mm of this length. इतना छोटा नहीं होना चाहिए because we get reinforcement from this alveolocrestal bone also, right? So that is one big factor. You can write it in your notes. So this is very important. This is coming from gross length, but I want you to write it down. We are still talking about the post length. I don't think so. It is possible for me to complete the class today because I will only be rushing it. No point in, because this is an important topic. So, okay, so I can't help it. Although they didn't give me two classes for this, but I can't help it. I'll have to request them to give me another one. So, to provide optimal retention, please write this down. To provide optimal retention, the pore should equal the crown in length. ये बहुत सारे मैंने तुम्हें फैक्टर्स दिए हैं यहाँ पे. I'm giving you 3-4 फैक्टर्स है कि इसमें से जो भी तुम यूज करो कर सकते हो फॉर डिटरमिनिंग कि मेरा पोस्ट का लेंथ क्या होना चाहिए. Post should be equal to crown in length. A is equal to B. As you can see in the image, ये crown है, ये तुम्हारा पूरा tooth है. या तो तुम पोस्ट की लेंथ को डिटरमिन करने के लिए जो पोस्ट की लेंथ है वो क्राउन की लेंथ के इक्वल कर सकते हो. ठीक है. इफ यू सी अ टूथ ऑन द रेडियोग्राफ एंड इफ यू थिंक कि क्राउन लेंथ और रूट लेंथ में ज्यादा डिफरेंस नहीं है मेजर, द रूट लेंथ इज नॉट वेरी लॉन्ग, राइट? आई रिपीट, द रूट लेंथ इज नॉट वेरी लॉन्ग. In such cases, you can go for A is equal to B. What is A? A is the length of the crown. B is the length of the post. The post length and the crown length can be equal. The second one we have is B, the post length can be two-thirds the length of the root. Two-thirds the length of the root. Just to try to look at the labeling. B, which is the length of the post, is equal to D, which is the length of the post plus the entire plus the gutta percha that is left. मतलब easy है, don't complicate it. इसका क्या मतलब है? It can be two-thirds the length of the root. Two-third parts of the length of the root. पोस्ट की जो लेंथ है दैट कैन बी इक्वल टू द लेंथ ऑफ द पोस्ट plus the gutta percha that you've left, whichever is greater. I hope I'm clear. Please write this down. It can be two-thirds the length of the root. First one is post can be equal to the length of the crown. The second one is post can be two-thirds the length of the root. The last one is simple that I told you. The length of the gutta percha remaining at the apex should be minimum of 4 mm or maximum of 5 mm. This is a Viva question कि हम इतना GP क्यों छोड़ते हैं? We leave it because there are lateral accessory canals on the side and you don't want to hinder that, and basically you do not want to hinder the apical seal of your root canal treated tooth, right? So I hope you've drawn this diagram. So ideal, anyone? Bhavna, you have a question? Bhavna?
No, ma'am.
Okay, okay. Ideal length of a post with 5 mm of apical scale. Now, इसके अंदर if you correlate, there is no dead space. You see a good post. It is a custom post. Custom क्यों बोल रही हूँ मैं? Because core is also fabricated together. It is a cast post or a metal post. I'm trying to show you here. तुमने wax यूज करके पूरी कनाल की उसकी measurement record की है. You sent it to the lab. The post is fabricated inside the lab. You've done the try-in. You've cemented this cast post. And as you can see, 5 mm apical seal को respect करते हुए, you place the post in core, and now you will be putting a crown on top of it. Right? I'm trying to. This is the second factor that we have to discuss. But I'm trying to think of taking a revision quickly because anyway we are going to be doing it in the next class. Okay. So before I go for a revision, I want to ask you a few questions there, just to know whether or not you understood anything out of my class today. Anything. So I'm going to randomly pick people and ask you questions. Randomly open up. You have to turn on your this thing. What? Cameras? Okay. I'm going to ask questions from Arti. Arti, unmute yourself. Don't take so long. Arti, yeah. Arti, my question to
Yes,
you is, um, when do we go for a postal course?
Ma'am, according to the walls present, if there are less of two.
Very good answer. That's good enough. Thank you, Aarti. Bhavna, are you there? Unmute yourself.
Yes, ma'am.
She said based on the walls, remaining cavity walls. Very nicely answered. नहीं तो कुछ भी इधर उधर का आंसर करती उसको समझ नहीं आता लिखना क्या है. Now she said remaining cavity walls. Now can you tell me exactly कितनी walls बचती हैं तब हम सोचते हैं कि we should go for a postal course. Bhavna?
Ma'am, like MOD, two wall,
Yes, two wall and
and ma'am,
two wall is one criteria. The second criteria is three walls, right?
yes, ma'am,
And fourth criteria is कोई wall नहीं है. We have to check कि कितना
complete.
parole बन सकता है. Right? Thank you. Bhavna, thank you. You can mute yourself. Tanisha Singh, are you there? Tanisha.
Yes, ma'am.
Yeah, Tanisha, my question to you is what is a farul?
Ma'am, ferrule is a band of extra coronal material at the
Uh,
cervical margin of the crown.
okay, you when you said extra core material, everybody is anyone जो ये मानता है कि
Extra coronal material.
extra coronal material. Extra
Yes, ma'am.
coronal, right? Okay, very good.
Yes, ma'am.
Very good. Coronal. Coronal makes a lot of sense because I'm trying to tell you here again and again. Ferrule is made of the crown tooth structure itself. इन नो वे मैं ये बोल रही हूँ कि फरूल तुम रेस्टोरेटिव मटेरियल से बनाओगे नो एम आई क्लियर इट्स वेरी
Yes,
इंपॉर्टेंट
ma'am.
एस्पेक्ट एंड व्हाई आई एम एम्फसाइजिंग व्हाई आई एम सेइंग कि आई विल आस्क फॉर अनदर क्लासेस क्योंकि इफ यू आर नॉट स्टडिंग दिस यूनिट then after final year all you'll take from the department is acha this is the department which is limited to root canals only no 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 if you are practicing even if you're going for a general practice after this यू शुड बी अवेयर कि ऐसा कोई ट्रीटमेंट होता है जिसमें मैं पेशेंट को प्रॉमिस कर सकती हूँ दैट इट विल लास्ट लॉन्गर अगर तुम्हें पता ही नहीं होगा हाउ यू गोना डू इट राइट सो शी डिफाइंड फरूल फॉर मी नाउ खुशबू कैन यू टेल मी फरूल की हाइट कितनी होनी चाहिए फरूल कितनी लेंथ का होना चाहिए मैंने बताया नहीं डिड आई नॉट कवर इट इन द क्लास मुझे
Ma'am,
ऐसा लग
shorter than 1 mm.
No, I think then I have not covered it. If you're giving me that answer, then I have definitely not covered. Okay, I think मैंने cover नहीं किया है because मुझे याद नहीं आ रहा है. ठीक है. It's good that I'm gonna cover it in the next class. Okay. फरूल की height और width होती है, length या width होती है, उतनी होनी चाहिए. वो हम discuss कर रहे हैं. No point in telling you right now. चलिए. तो फिर मैं question पूछ रही हूँ. I'm asking आकाश शर्मा. Unmute yourself, Akash. I can't see your face. You're all black screened up. Akash, sleepyhead. Shalu, are you there? ये आकाश ये बंदे बैठते क्यों हैं क्लास में धनंजय माथुर I can see your fan DJ you call him DJ right DJ chef are you there kindly unmute yourself I'm so sure that this guy has just switched on the class and slept this is going to YouTube you're gonna be listening this on YouTube if you got to answer now Anam are you there
Yes, ma'am.
Yes, Anam, I have a question for you. I only discussed one of the factors for post selection. What was that factor? Can you tell me?
Ma'am, on the basis of the remaining walls.
No, this is not my question, Anam. I'm saying in the last few slides, I was telling you post selection के factors क्या हैं और principles क्या हैं. What are the
Ma'am, the
principles?
post should be equal to the length of the crown.
So the factor name is known as post length, right, Anam?
Yes, ma'am.
Post length. अब post length पहले आप बोलोगे उसके बाद factors बोलोगे, right? So first factor that
Yes,
I
ma'am.
majorly most important factor is post की length कितनी होगी, right? So you can mute yourself. I'm gonna ask another person. Sanjana, these people have not even switched on their Anamika, can you tell me one of the factors जो post length determine करने में help कर सकता है?
The tooth anatomy.
Sweetheart, that tooth anatomy is another factor on itself. वो अलग principle हो गया. वो तो मैंने discuss भी नहीं किया अभी, right? संजना, can you tell me post length का एक factor बता सकती हो जो हम सोच सकते हैं कि हाँ
And
इसकी
3/4 length of the root.
3/4 length. Absolutely, very nice, very nice. Ria, can you tell me another factor? Ria Mittal, black screen. Now this is very annoying when you guys don't even open like switch on your cameras. Manohar Singh. Manohar Singh.
Yes, ma'am.
Yeah, Manohar, can you tell me another factor post length में जो हम use कर सकते हैं?
Ma'am, in average short-rooted tooth, post length is determined by remaining 5 mm of apical gutta percha.
Very nice. You have to leave apical 5 mm तो छोड़ना ही है. उसके बाद तुम जितना बचेगा उससे post length define कर सकते हो. And Manohar, another question to you. Long rooted teeth में क्या करेंगे?
Ma'am, वो 3/4 length of the root.
ठीक है. एक और फैक्टर हम मिस कर रहे हैं. कोई बता सकता है पोस्ट लेंथ में मैंने डिस्क्राइब किया था एक और फैक्टर इस डायग्राम में?
4 mm.
वो तो हो गया 4 mm. पहले मैंने क्या लिखा? पोस्ट शुड इक्वल क्राउन इन लेंथ. ये वाला किसी ने नहीं बोला. क्राउन की लेंथ का भी हो सकता है. और जो क्राउन तुम्हारा बच रहा है या जो बच रहा है क्राउन वो नहीं. When you look at a tooth, you know ये इसका क्राउन लेंथ कितना होगा क्योंकि कुछ कुछ पोर्शन तो मिसिंग भी होगा, राइट? तभी तो पेशेंट आया है तुम्हारे पास, right? But the easy way out is to respect the 5 mm apical seal and go for it if it is a short rooted tooth or a long rooted. Right? काफी technical questions हो गए. Now I want to actually ask you one very basic question that comes to everybody. कोई ऐसा इंसान बैठा हुआ है यहाँ पे आज क्लास में जिसको पता ही नहीं है what we are talking about? And absolutely okay. If there is somebody who does not know what we are talking about, please raise your hand and tell me. कि समझ में नहीं आ रहा what is happening in this class today. Nobody? Okay, just try and look at this image on the left. क्या दिख रहा है? अब कौन मुझे बताएगा कौन सी इमेज में आपको फेरूल दिख रहा है? मैं ही पूछ लेती हूँ. Let me ask you. I'm trying to make this unit very, very easy for you, which it is not even for the residents. Okay. Last वाले बच्चे हमेशा बन जाते हैं. अमित कुमार, are you there, अमित? फोटो तो बड़ी अच्छी लगा रखी है. अमित कुमार. Amit, that's what. You guys are just not listening. Anyway, Kanishka. Okay, Kanishka. से तो आज कुछ पूछा ही नहीं. Kanishka, you there? Camera on क्यों नहीं किया है? Kanishka. ये तुम्हारे अच्छे स्टूडेंट. धनंजय ने ऐसा सोया है वो ऊपर फोन रख के that and he's muted obviously snoring and we're not able to hear his loud snore. Dhananjay. Nisha, okay, the question for you. Can you tell me इस वाली image में which image is showing the ferrule? Nisha?
Yes, ma'am.
Yeah, Nisha, you heard my question, right?
Yes.
Ferrule किसमें दिख रहा है निशा इस वाली image में? कौन बता सकता है? अनम्यूट करके बताइए प्लीज.
हम सेकंड वाले में.
कौन बोला?
दीपेश.
नितेश.
दीपेश.
Okay, Dipesh. Second वाले में. Very, very nicely done. Nicely answered. Dipesh, can you define ferrule again in your own words? In your own words.
And band of extracorporeal material at the cervical portion.
Right, absolutely. So now is it clear कि ये जो ferrule होगा ये tooth का remaining structure ही होगा. In no way The ferrule will be the composite restoration or whatever kind of material that you're using to restore the tooth. In no way ferrule will be replicated by that restorative material. Am I clear? I also defined ferrule as a bracelet to you, right? अब ये तुम देखो, look at this image. अब मैंने क्या किया, clinician ने क्या किया, they did द क्राउन की जो हम प्रेपरेशन करते हैं, क्राउन प्रेप जो तुम्हें प्रोस्थो वाले सिखाएंगे डेफिनेटली, या सिखा भी होगी, 5 principles of crown preparation, right? All of that, axial preparation, occlusal preparation. So we've done that here, right? But that band, you're still visible, right? The remaining crown structure is still visible. ये सब होगा उस टूथ में, तभी तुम उसके ऊपर पोस्ट और कोर दे सकते हो. If this is also not available, then sorry, forget about you trying to save the tooth. It is not gonna be, you're not gonna be doing any good to the patient, right? So let's just quickly go through whatever I discussed today. I'll come back with the dimensions of the ferrule in my next class. So we basically, I told you, started from where all you are not supposed to initiate the treatment. These were the factors. Then this is a very, very beautiful decision making chart, which is absolutely based on kitni walls are remaining, how many marginal ridges are there, if the cingulum incisor ridge is intact or not in cases of anterior. Most importantly, factor that you have to determine in anteriors is not just the walls remaining, but also aesthetics. Some patients will absolutely come to you when the tooth is black. It is absolutely non-vital. The pulp is necrosed. In such cases, even if you're done with a good root canal, the discoloration will not go. It is still gonna look brownish black, right? In such cases, even if the tooth is, absolutely intact, ज़्यादा tooth structure टूटा हुआ भी नहीं है. In such cases, you will have to cover the tooth. And posteriors में तो कोई question है ही नहीं. It is very clear. Cuspal coverage is required for all the teeth because you have maximum masticatory load on those teeth. Next, this is a beautiful picture I showed you. Right, depends on the number of remaining cavity walls. 2, 3, 4. In सब में postal को चाहिए. Then क्या होता है, एंडोडोंटिकली ट्रीटेड टीथ में कुछ कुछ फैक्टर्स ध्यान रखने होते हैं, right? These were the factors. The most important one is creating ferrule. What is a ferrule? The dimensions I'll get you in the next class. Okay, the class is about to end. We have some more interesting things coming up. See, the topic when you open the book will look very dry to you because they're not asking you to perform clinically. So you might feel ये बड़ा theoretical topic है, समझ में नहीं आ रहा. Maybe I'll have to mug it up and just vomit it out in the exam. जबकि it is not so. It is absolutely not so. When you read like this, the way I've got you today, I'm sure you'll be excited to perform the treatment yourself, right? I'm just taking a quick, feedback from you if whatever I taught you today is clear or not. Just anyone or few people can just tell me quickly.
Ma'am, in multi-rooted teeth, how many posts can be given, or only a single post is
Okay,
being given?
that's a very, very, very interesting question she put. In multi-rooted teeth, how many?
A post.
Okay. Any other question, please? Quickly. No, no questions. Okay, good question. Who was that?
I'm Pooja.
Pooja. It's a very, very good question. अब तुम मुझे बताओ कि पोस्ट हम क्यों दे रहे हैं in the first place?
I'm for the retention of the core.
Absolutely, very nicely answered. अब तो मुझे बताओ कि हम कोर को रिटेंशन कब दे रहे हैं? उस साइड में देंगे मल्टी रूटेड टीथ में जिस साइड में सबसे ज्यादा क्राउन स्ट्रक्चर मिसिंग होगा, सिर्फ फेरूल जितना स्ट्रक्चर प्रेजेंट होगा, राइट? अगर फेरूल से ज्यादा क्राउन स्ट्रक्चर प्रेजेंट है तो तुम पोज दोगे कि नहीं दोगे? अगर मेरा क्वेश्चन, मेरा लॉजिक इसके पीछे ये है, अगर मेरे पास बहुत ज्यादा टूथ स्ट्रक्चर प्रेजेंट है तो क्या मैं उसमें पोज दूंगी कि नहीं दूंगी?
No, ma'am.
नहीं दोगी ना, राइट? लुक एट दिस इमेज. अब ये तुम्हें एक फिगरेटिव सा इमेज दिख रहा है यहाँ पे, बट इसको इमेजिन करो, ये जिस साइड में पोज दिया हुआ है उस साइड में थोड़ा केरियस डीप केरियस था इस साइड में, ठीक है? बट इतना टूथ स्ट्रक्चर प्रेजेंट था कि तुम अपना फरूल बना सकते हो, राइट? अब दूसरी साइड में भी अगर यही सिनेरियो होगा डिट्टो, या मीजियल डिस्टल वॉल दोनों मिसिंग होगी, तो तुम दोनों साइड में पोस्ट दे सकते हो या नहीं? जल्दी आंसर करो।
मैम दे सकते हैं।
दे सकते हैं। अब सी, मोलर्स में या मल्टी रूटेड टीथ में एक रूल है, जो सबसे वाइड कनाल होगी ना, जो सबसे मोटी कनाल होगी, हम पोस्ट उसमें ही डालेंगे। जो कर्व्ड होगी, थिन होगी, हम उसमें पोस्ट नहीं डालेंगे फॉर फर्दर कॉम्प्लिकेशन। ठीक है, तो दिस आंसर्स योर क्वेश्चन कि हम दो पोस्ट दे सकते हैं या नहीं। अगर टूथ बिल्कुल ही सैल्वेजेबल नहीं है, 3 वॉल्स मिसिंग है, 4 वॉल्स मिसिंग है, तो फिर वी माइट नॉट इवन गो फॉर अ पोस्ट। और जो तुम कह रही हो 2 पोस्ट दे सकते हैं, एब्सोल्युटली दे सकते हैं। व्हाट फैक्टर्स योर पोस्ट विल डिपेंड ऑन, कि कर्व कर्व तो नहीं है कनाल, क्या मैं उसके अंदर पोस्ट डालूंगी तो परफोरेट तो नहीं हो जाएगी मेरी कनाल मल्टी रूटेड टूथ की? क्या होगा, कभी कभी मोलर्स इतने ज्यादा कर्वेचर वाले होते हैं कि मैं यहाँ पोस्ट डालूंगी और पोस्ट अलग डायरेक्शन में जाएगा, मेरा जीपी अलग डायरेक्शन में जाएगा। तो डू यू थिंक यू आर डूइंग एनी गुड टू द पेशेंट? नो, राइट? तो क्या होता है, डेंटिस्ट्री में ऐसे मटेरियल्स अवेलेबल हैं, मटेरियल्स लाइक रिबॉन्ड, लेट मी, डू यू हैव अ क्लास कमिंग अप? जल्दी से बताओ, जल्दी जल्दी।
नो मैम।
डू यू हैव अ क्लास? बट ऐसा होता है कि somebody is waiting for next class, so let me just show you so you know कि मैं बोल क्या रही हूँ. This is going to be the last thing. I'm sorry about that. Let's do my yoga class. Quickly, I have to tell you. Okay, maybe I'll get it in the next class. This is it. This is gonna be the last thing I take. Any further questions we can discuss in the next class. So I again forgot your name. Who asked me that question again?
हाँ पूजा।
पूजा। या पूजा, सो व्हाट आई एम ट्राइंग टू टेल यू कि दो में पोस्ट बिल्कुल दे सकते हैं, पर हम उसकी जगह क्या करते हैं, हम ये करते हैं, देर इज अ थिंग कॉल्ड एज रिबॉन्ड। रिबॉन्ड एक फाइबर होता है जो स्ट्रेंथन कर देता है टूथ को कोर, लाइक स्ट्रेंथन कर देता है आपके कोर को। डू यू सी दीज फाइबर्स? तो हम क्या करेंगे, ऐसा कोई केस होगा जिसमें 2-3 वॉल्स मिसिंग होंगी, तो एक में तो पोस्ट डाल देंगे और दूसरे में ये फाइबर्स डाल के उसको ल्यूट कर देंगे अंदर से। तो ये क्या करेगा, स्ट्रेंथ प्रोवाइड करेगा आपके कोर को। डू यू सी why we are not giving post in this case? Not in this case, दो पोस्ट देना थोड़ा डेंजरस हो सकता है फ्रैक्चर हो जाए। अनलेस एब्सोल्युटली नेसेसरी, दो पोस्ट हम अवॉइड करेंगे, उस टूथ के कोर को ऐसे स्ट्रेंथन करने की कोशिश करेंगे, मटेरियल्स लाइक दीज। एम आई क्लियर यू गाइस? बहुत सारी चीजें डेंटिस्ट्री में जो आपको अभी तक नहीं पता है, बट आई एम ट्राइंग टू हेल्प यू है, to just maybe you can think what all is there. Okay, Pooja?
यस मैम।
Okay. Any further questions?
नो मैम।
Are you guys clear with what we're talking? थोड़ा सा difficult है, but इतना difficult नहीं है. Right? Can we end the class? It's late. Only 50
यस
people
मैम।
in this class. That is very disheartening. I'm so sure if the question pops up in your exam, most of the people जो आज नहीं बैठे यहाँ पे, they will only write अच्छा क्या करना है restoration में, चलो crown कर देते हैं. And these people who are not attending the class, you know what they'll write in the exam? They'll write all the principles that are being taught in Prosto for crown, and you will get 0 in that. Right? Do not write principles of crown preparation. Please, that's not the question here. Okay? Chalo. With that note, I'm going to end the class. You have a good day. Bye bye.